Great. So this is February Journal Club. So I want to thank everybody for coming to the Medical Education Journal Club for February. And I'm very thrilled to see some of our basic science here, faculty here. And I want to thank Janet Lindsley for coming and presenting from Utah her original paper. And just to give people some background, these are RIME papers, research in medical education papers, which are very, very prominent papers to get into the RIME issue in November of academic medicine. And then some of them are presented at the conference in November, and I was privileged to hear this paper. And right away, I said this would be such a great medical education journal club. I always don't focus exactly on basic science in my journal club, so I'm really happy to do that. And then I went to the best discussant I could get for this paper, which is Joanne Willey, our famous, infamous chair of our only department in basic science, and really does an amazing job with working with faculty and, of course, students as well. So I want to thank Joanne for being here, and I really appreciate that. And I see a bunch of people signing on, which is great. And I see some of our non-basic science people signing on, which I think is wonderful because it's important to understand, we know the basic science is such a strong part of our curriculum, and I hope other places, and how this is perhaps influencing our medical students.
Holy moly, my computer's dead.
Nicole, I don't know if you really wanted to say that to everybody.
Oh, I'm so sorry.
That's okay. Okay, Janet, I'm going to have you introduce yourself because I find with a speaker, it's so nice when you give your perspective on who you are. So if you could do that, and then we'll get started and share your PowerPoint.
Great. Thank you. Thank you so much for inviting me. It's fun to talk about this, and I can't wait to hear your perspectives on it. Even if you think this is a bunch of bunk, that's fine. So I'm a biochemist. I've been at the University of Utah for well over 30 years. And I also serve as our assistant dean for a curriculum. I used to be the assistant dean for foundational sciences, and my title was recently broadened, I think, so I could just take care of whatever problems show up and not just those in basic science. I don't know. But I'm going to tell you about something I've been thinking about for a long time. And it really gets down to like, what am I trying to do? It's assistant dean of foundational sciences curriculum. So let me start.
Are you able to share? I think you should be
I
able.
should be able to.
Yeah, just to. And are you originally from Utah? Just some background. Are
I'm
you?
originally from Long Island, near
Oh
Stony
my.
Brook.
Oh, so close to us.
Yes.
And where did you do your training, in Utah, or you
Oh
just?
yeah, sorry. Sorry, I forgot about all that stuff. I got my PhD in Wisconsin and was at Harvard for a while as a postdoc, and then I've been at the University of Utah ever since. Sorry.
Great.
Yes.
No, great. But you're originally from Long Island, so welcome back to Long Island, I should say.
Yeah. Yeah, great to be here. Yeah, okay. So this is our title. This is sort of our question. How, if at all, does the basic science component of a medical education contribute to professional identity formation of medical learners? And I have no conflicts. Kind of wish I did, but I don't. And this is the paper. I think you've all been sent this paper, so this is what we'll be talking about. And the three learning objectives have to do with the learning theory that was recommended for us and we ultimately chose, called Landscapes of Practice. And then using that learning theory, thinking about how basic science, that component of the medical education, contributes both positively and negatively to the professional identity formation of medical learners. And then, hopefully to help you reflect on your own teaching and how this may help reframe your thinking. And I'll give you one example of how it helped reframe my thinking about my teaching. I teach metabolism and nutrition to medical students. And for this paper and presentation, we took a very traditional definition of basic science. And I realize this is not the way everybody defines it, it's limiting, but we took the very traditional basic science definition: anatomy, physiology, biochemistry, etc. So I understand if you would prefer we had a broader definition, but this is the one we chose for the study. And for quite a few years, our medical school's been talking about professional identity formation in a lot of contexts, and a lot of schools have. And I've just been thinking about, I think just sort of the idea of identity formation is something that I've been personally very interested in for a while. And so these are just some of the definitions that we're working with. This is one: the cognition, activities, and values members of the profession come to embrace. And maybe a more familiar one to medical education is from this quote, originally from Merton: how the novice is shaped into an effective practitioner of medicine to give him the best available knowledge and skills, and to provide him with a professional identity so that he comes to think, act, and feel like a physician. And this contribution to thinking, acting, and feeling is a lot of what we went for. So this definition. And I'll also say locally at the University of Utah, quite a few years ago, a program developed called Real MD that started for first-year medical students. And it kind of developed in contrast to the curriculum we have. And it's a great program of identity formation for students to help think about their values, their purpose, how they fit in the community meeting. But it was also kind of developed in contrast to our real curriculum, or official curriculum, which slightly got under my skin. Of this is the real MD, and what I was in charge of was the basic science garbage. And so this is sort of where my head was going for quite a while. And again, looking up the professional identity formation, or PIF, there's almost nothing about basic science education in there. It's a lot about role modelings and medical humanities and ethics and lots of things that are absolutely important. But this little white person here is sort of me pondering for quite a while. If basic science doesn't impact how physicians learn to think, act, or feel, then what is the point? What am I trying to do? So that's where I came at this project from. And one of my colleagues, Jory Colbert-Getz, those of you in medical education might know her. She's quite well known in the medical education world. I think she was sick of hearing me ask this question. And she said, why don't you just put together a systematic review to try to find out something about this and stop bugging me about this. So about 5 years ago, that's what I decided to do, and gathered together a wonderful group of colleagues and who are all listed here from a variety of institutions, and wanted people with different perspectives. We have Mary Soul is a wonderful librarian who joined us, several PhDs in different fields of science, but also education, and some MDs as well, to try to quite honestly look at this question.
And I see you put Nikki Woods in there. She's a pretty famous PhD person.
Yes, that's right. That's right. In sort of educational studies. Yeah. And so we refine that question better than what's the point of my job, to be this question, which was the title of this talk: how, if at all, does the basic science component of medical education contribute to the professional identity development of medical learners? And for some reason, we chose the word development instead of formation. We had long discussions about this. I don't even remember what the argument was, but I'm using them interchangeably in this talk. most of the literature talks about professional identity formation. That's what I'm using in this talk. And please, if you have any questions while I'm yabbering on, please ask me. So this study started off as a best evidence in medical education, or a BEME scoping review. So they have a whole process that we followed. In March 2021, we registered our topic, and that kind of means that nobody else can have that topic for a certain period of time. We wrote up an official protocol and submitted it. And then we got the reviewers' comments about the protocol. This is actually really nice, as they give you comments about the protocol, and they're incredibly helpful. Especially, I'd never done a scoping review other than our librarian. I don't think any of us had done really many systematic reviews, so we needed help. And it was actually a reviewer who recommended we use this landscapes of practice learning theory, which in 2021 I had never heard of, and nobody on our team had ever heard of. So they recommended that, and it became apparent that it was time to learn what the heck that was. But we learned at least some basics, and we resubmitted our protocol. And then at the end of that year, it was accepted as a BEME official protocol. So that's where we started off several years ago. And so, I had to go learn what landscapes of practice was. And there's a, I think, really well-written book by Etienne Wagner Trainer and colleagues about landscapes of practice. I've just copied a quote from here. I won't read the whole thing. But it's sort of about this idea that, if a body of knowledge of a profession is a living landscape of practice, then our personal experience of learning can be thought of as a journey through that landscape. So, that sort of develops this whole idea that any learner is traversing a landscape and interacting with different communities of practice and growing and developing in different ways. And it gets at the idea that we're all on our own journey, although certain aspects may be in common between people. And that our identity is negotiated with each new community we interact with or participate in. Okay. So Dr. Wagner Trainer is also the person who did a lot of work on communities of practice. So this is kind of going beyond communities of practice. So I also had to go back and read his book on communities of practice to understand that. And I'll say I am in no way, shape, or form an expert in this learning theory. I read the book a few times, took a bunch of notes, did my best to try to understand it. But those of you with a social science background will probably tell me I misinterpreted it. Anyhow, this is what we chose. It had a lot to do with
I don't feel bad, Janet, because I have read a tremendous amount about educational theory. I have a big proponent of Wenger in terms of his work with community of practice, and I've never heard of what you just presented. So thank you for presenting this.
Yeah, so you can tell me if you find it a useful way of thinking about things. But one of the ideas in his book and his talks is something that made sense to me. And it makes sense to me in terms of thinking of an analogy to an old story of the stone cutters. And it talks about ways that we may each be doing the same thing, but thinking about ourselves, having those internal dialogues that are different in every case. And so this analogy is, let's imagine our first stone cutter over here is thinking about what he's doing in terms of cutting a perfect block of stone. And that is his contribution and what he is doing. And then that's defined in terms of the landscapes of practice, in terms of engaging in the activity of cutting a perfect stone. Then the guy in the middle, he is imagining in his mind what's going on is he is contributing to the construction of what's going to be an amazing castle or a cathedral. So he's really imagining what he's contributing to. And the third person is more seeing himself in alignment with what the foreman is saying, of like, what should all the people doing who are working on constructing this castle, how do they all fit in? So really alignment with the ultimate goal. So again, they're all cutting blocks, but they're all thinking of themselves in somewhat different ways. Okay, so I'm going to come back to this engagement, imagination, and alignment framework in briefly. But that's where it comes from. It's directly out of Wagner's book, and so we borrowed that. And then we just follow the published scoping review process. Again, this was something brand new to me. So we just read the literature on how do you do a scoping review, and there are several papers that kind of give step-by-step instructions, including one by Levesque et al. That recommends including expert consultation and towards the end. So once we got our results and we were trying to make heads or tails of them, we actually shared these with 4 experts around the world and did interviews with them. And that was actually incredibly helpful. So I thought this was a great addition to the protocol. And then we did what we're calling a critical interpretation of the results based on landscapes of practice. One of the things we decided, and I remember Nikki Woods particularly, was like, if we're going to do this, or we're going to do all this work, I don't want it just to be we just list a bunch of facts and then we're done. Let's make heads or tails of this. Let's interpret it and try to say something, whether others agree with us or not. So that's where this interpretation based on the learning theory comes in, which is ultimately became a major part of our paper. But that's the process we followed. And so starting with the literature search, this was a lot harder than I expected it to be. We had a librarian who was doing it for us. But what turned out to be really difficult is making it both sensitive and selective. So we had chosen 12 what the librarian called golden bullet references, ones that we knew we should be able to find in our literature search. And we didn't want to get an outrageous number of irrelevant references pulled up. And we had to go back and forth a lot to get a happy medium between these two. And it was way more difficult than I thought it would be. And maybe it's just because our research question wasn't specific enough. We had a bad topic, I don't know, but this was hard. And we decided what we wanted to do was capture the broad conversation around this topic, right? So we were not going for, what the best evidence, like you had to have proof or anything. We were really trying to capture the conversation around the topic of basic science and physician professional identity formation without having too much redundancy. And it took us a while to come up with inclusion and exclusion criteria. It really was an iterative process. Again, it's not perfect. It was harder than I imagined it would be. And these were our inclusion criteria that we chose. Started at 1988 based on something called the Edinburgh Declaration and went until October 2022 and we were done. Everything had to relate to the profession of medicine. There was some interest in comparing physicians to other healthcare providers. And we decided that, even though it was an interesting question, was not our focus and would be too hard because we'd have to do this for every profession. That we decided we couldn't do. Had to directly talk about basic science and the impact on the learner, including thinking, feeling, acting like a physician. We also added specialty choice. So that wasn't part of the original definition of what other people have defined as physician professional identity formation, but we thought this was important, so we added it. And we did it in English and Spanish. We had 2 Spanish speakers who could help us with the Spanish articles. And so this is what it ended up looking like. By sort of the automated search processes, we had over 6,000 citations. We found another 63 by hand, which for the life of me, I have no idea why they didn't come up in these original citations. So it's something I still don't understand. And so we did the title and abstract screening of those, and a full text review then of the ones that passed muster. We had excluded most of them, thank goodness. And we had 257 that met our criteria we then had to deal with. And for any of you who, I don't know how many of you have done systematic reviews, one of the people on our team recommend we use this thing called Rayan, which at least at the time was free. And it's got AI features. We didn't use those AI features, but man, for doing a systematic review, particularly people all over the world, it was awesome to use Rayan. So I really, that was incredibly helpful. And then we extracted the data and began to analyze it. We just used shared Google Sheets for that. We extracted sort of the obvious data about author, title, journal year, etc., type of article, level of the learner, which basic science discipline or medical specialty, if there was one specifically given, study purpose, methods, learning theories, a lot of stuff. Kirkpatrick's evaluation level. And then what I think became most useful was the key results field. Like, and we had to spend some time, and again, this was not trivial, but trying to extract what is the impact of basic science on the learner related to professional identity formation. That was talked about somewhere buried in the paper. Because essentially none of these papers were specifically about this topic, because there was almost nothing in the literature about this topic. So we were searching for something in these papers. And so I'm just showing you the results of some of the basic stuff. Most of the papers came from the US, but we did have papers from all over the world. With time, there were more and more papers that seemed relevant, but we didn't look at what's the increase in medical education papers. I think that's probably similar to this. And there were levels of learners. Most of them were medical student level, but we also saw articles talking about other levels of learners. Basic science discipline mostly was general, but after that was a lot of anatomy papers. And the anatomy field, I think, has appreciated before many of the rest of us the importance of professional identity formation and how really, especially within cadaver dissection lab, one could think about how to help students develop their professional identity. So that's this big orange section. But there are also, genetics has quite a few, neuroscience, and then the rest of us are in here. But the biggest group was just general, didn't say which basic science. And then in terms of medical specialty, vast majority, way out here, off scale, was general, not specified. And then there were some small numbers from specific fields, talking about the importance of students learning basic science and why they thought that was so important. Because we wanted to capture the broad range of discussion on this topic, we took any paper that seemed to have a significant something to say about the role of basic science and how physicians think, feel, act, or choose a specialty. And so there were descriptive, lots of opinion papers, review articles in there, as well as empirical studies. And probably no surprise of those empirical studies, most were sort of low level on Kirkpatrick's level of evaluation, mostly reaction. How did you feel about this as a student? Or what did you think as a faculty member about this? Some maybe 20% of the papers actually looked at, did you see an increase in learning in some way? Very few behavior and result level. So that's not too surprising. So these are just kind of like the background features of the kinds of articles we found. And then came the hard work of doing the content analysis of that key results field. So 4 of us did that to code these charted data. And then Nikki Woods also was really helpful then in helping us like think about this in terms of the landscapes of practice framework. But it was also, we shared the data then with our 4 experts, and Candace Chow, Dr. Chow, did interviews with these 4 experts to just get their feedback and impressions about it. And, you know, I'll say I was somewhat skeptical about the utility or the purpose of doing this, but it ended up being absolutely key. They saw things that we didn't see and helped us reframe the way we were thinking. So it was actually really great to have their feedback early on. Okay. So here are some of your discussion questions.
Okay, so Alice, is this where I jump in?
Yes, I guess
Yeah,
so.
you got it.
All right. So first I want to thank Janet and encourage everybody to actually read the paper because it's really fascinating. So just some things for us to pause and think about. So one thing that struck me was the fact that papers came from a broad time range from 1990s through the up to 2020 plus. And as we all know, medical education has undergone quite a transformation in that time. So wondering how that might impact the findings. And sort of a related question, this just actually just digs down one rather than a sort of temporal, but more of the content, just thinking about the techniques like case-based and problem-based learning, team-based learning. Hardly anybody, I don't, maybe Alice can verify, but hardly anybody, if anybody, was doing that in the 90s.
Right.
Yeah. So, and if you think about, we all know the difference in dynamic between an instructor and the students when you're using something like case and problem-based learning versus a lecture-based format. And then the other thing is the context in which all of these studies occurred. So if I would imagine there's a very big difference between what goes on in an integrated curriculum versus what goes on in a more traditional siloed curriculum. So does anybody have any thoughts about any of these in terms of how you would think this might impact the findings or any additional items to list? And
Yeah. So
those-
this is in discussion time for everybody. If you're not as accustomed to the journal club, we pose questions in between before we get to the data. This is, we went through the methods, and any thoughts from anybody, just speak up.
So people who know how I teach know that I cold call. So I'm gonna just warn everybody that I'm gonna go into cold calling mode if nobody offers.
I'll stick my neck out. I was just in Pearls with our second year students, and as a wrap up, I asked them for what has been their most impactful experience so far in their professional identity formation. And they all had different things that they said, some very personal, some not, but I felt like there were 2 themes that emerged. And most of them happened in their clinical time that they've had even in their first 2 years, but role modeling and feeling a sense of belonging were themes that came out of just about all of their answers. So I would imagine that a case and problem-based learning and an integrated curriculum would provide more opportunities for those things. And I will stop talking.
But, Gabby, it's interesting because here you're doing this in the setting of, somewhat of format of problem-based learning, it's some type of format. And you're not a basic scientist, but basic scientists do lead those sessions. And do you think that, there is an impact of basic science on the professional identity of our students using something like a problem-based learning, which is definitely the later part of the data collected? Where in the past, let's say in the 90s, everybody was sitting in lectures and, having sort of this sage on the stage person just, speak to them.
I was just going to add, I also think when the faculty that are basic scientists are also involved in other parts of the curriculum, like diversity or humanistic efforts, I think that also reinforces role modeling, and I think that that adds to it versus back in the day when my professors were like almost untouchable, where you couldn't really ask many questions and you just went and sat in the auditorium and left and asked other people for help because there was no opportunity to interact. But I think when they see professors involved in other things, I think that adds to the professional identity formation role modeling.
Well, I think conversely, when we have clinicians interacting with basic scientists, for instance, in a large group session or in small groups. So for instance, right now, Dr. Nasrallah and Dr. Stevens are co-teaching some sessions. So I think that kind of modeling also impacts students' understanding of the role of basic science as well. I think what Janet started with, like, okay, what is basics? Like, what's the basic science? Are we chopped liver? Like, what are we? I think it's really important to have, I think it sends a positive message to students when they see the clinicians are also demonstrating how they use basic science to inform clinical care or their understanding of a topic. So
I think that's interesting because what you're saying is even, newer is the basic science and the clinical people teaching together, which even goes beyond some of the advanced pedagogies that we, traditionally talk about on this slide. But the actual co-teaching and integration, it'd be interesting if there were papers related to that. And does that really affect? So that's interesting. So just at a time, Janet, do you want to continue?
Sure,
Okay.
great. No, these
Great.
are really great questions and ideas.
Somebody have something they wanted to say?
Yeah, me, Lee. So
Lee, go ahead, Lee. Go
yeah,
ahead.
so in homeostasis, actually those physician faculty, they have really strong basic science background. So they always integrated the basic science with clinical science, so they can explain a lot of things underlying the clinical scenario. I think the student really enjoyed that.
Well, so,
Thank you.
right.
Yeah.
Okay, thank you. Lee is one of our esteemed pharmacologists, so
Wonderful.
go ahead.
So, yeah, no, I just want to remind you about these three modes of identifying within landscapes of practice, which is ultimately how we decided to group our data. So, just a reminder about that. All right. So yes, our content analysis and then the key results were organized in terms of these three modes. And so then in 2023, we submitted this as a BME scoping review based on this approved protocol. And as you might imagine, it got rejected because that's not where it was published. And
Amazing, because
it was sort of funny. Anyhow, I don't know exactly everything about why it was rejected, but they didn't like the fact that we really interpreted it. Our sort of what we ended up calling our critical analysis and interpretation of the results based on the landscapes of practice learning theory, which one of their reviewers had recommended. Maybe we went overboard on the interpretation. So in trying to figure out what next, yeah, we just decided let's go for rhyme and academic medicine. So we reformulated the paper, shortened it significantly, and luckily ultimately did get it accepted at academic medicine instead. So that was just part of the journey. And I have thought for quite a while about this whole idea of education as a transformation. And as a biochemist, this makes a whole lot of sense to me. And this is a quote that we started our paper off with. That's originally from Fuchs et al., but I have to say Hetty Wald, who writes in Professional Identity Formation, really brought it to our attention. That to be a physician requires a transformation of the individual. One does not simply learn to be a physician, one becomes a physician. And that whole process of transformation has been stuck in my head for quite a while. And I'm going to show you something in the next slide that might bring back really bad memories for some of you. But I'll just say I'm a biochemist and my scientific background is in enzyme kinetics, enzymology. So, and how the reactions in the body occur and the rates get increased by enzymes, etc. And so, you know, from a chemical perspective, this is a mock-up of a free energy level diagram, but it's also come to be how I think about education and professional identity formation and this process of transformation. So the idea here is what we're looking at on the y-axis is how much energy is required or how much effort to make progress. And from a chemist's perspective, this would be progress in a reaction occurring. But from an educational perspective, this is to model the idea of, you know, as students are developing and learning, they run into various barriers that take more time and effort, energy, and you know, there's ups and downs. I mean, I just drew this freehand. It's not a real energy diagram, but hopefully you get the idea. We all run into barriers along the way, and they're different for all of us for various emotional, personal, whatever educational reasons. And we hope that our curriculum and our faculty are acting as catalysts, which decrease the energy or the effort required to overcome these barriers. So I'm going to be using that term of catalyst. As a biochemist, this is an enzyme. That's what enzymes do. So catalysts decrease barriers, whereas inhibitors increase those barriers. And as we interpreted our data, we used this terminology. And I just wanted to share with you, this is where it comes from. It's because I'm a biochemist. I'm sorry if it doesn't work for you. It's the way my brain works. And so this is sort of a slightly redrawn view of our final data findings in the paper, where we organized everything, our findings under engagement, meaning, you know, do we find evidence about how engaging in the work of a physician, the basic science contributed to that? Or is it imagination? How one imagines oneself becoming a good doctor? Or is it alignment, aligning with the practices or expectations of a medical community or specialty? And in each case, we found things that we're calling catalysts or inhibitors. I think partly because of the time, I'm not going to go through every one of these. This again is sort of a simplification of the data from the paper. You know, probably what we saw the most of was that basic science provides a lot of the knowledge base and analytical reasoning behind becoming a physician. And that's a catalyst to the development of professional identity formation. But on the other hand, we saw evidence that excessive and irrelevant basic science content could actually be inhibitors to student progression. So that's how this table is set up. And again, these are data extracted from the literature with our interpretation of them and put into various categories.
Does anybody have any comments on this data? Or just, we're not going to go through it in detail, but certainly gives you a good scope of what Janet found.
I have to say, Joanne, the next is a discussion question. about it.
Well, I'd like the repulsion from specialty or practice location, as an inhibitor.
Yeah. So there's a bunch of papers. There's like a whole field of study about neurophobia. Of, for example, there's students who do not like neurology or find it terrifying, and evidence that they avoid the neurology specialty because of that. There was one paper from Africa, if I remember, and I apologize, I don't remember one country, that talked about how students who were really interested in sciences stayed away from rural locations. So that's where that idea that potentially people who are really into the science side of thinking as a physician are, avoid going back and practicing in certain locations. Those are just
I find it interesting that under imagination inhibitors, you have scientists think differently than physicians. Like, I guess I would think that's a positive thing to like have different ways of approaching a problem.
Yeah, and again, I sort of shortened what the papers actually found, but there's a few papers out there that talk about that were quite negative about the basic science component of a curriculum being taught by scientists, where the students are saying, look, I don't want to become these people. This is not my goal. I'm trying to become a physician. Why are you putting these people in my way? And, people who are just doing different things have different perspectives. So that's why it showed up as an inhibitor, because the paper framed it in terms of, my recollection is sort of like, we got to get rid of some of this stuff in our curriculum. Not helping. Yeah. Thank you for asking.
Along with that is decreased empathy and emotional development.
Yeah. And so you see, we have it both on the increase and the decrease. There are some papers, especially from Anatomy Cadaver Lab, where there are anatomy educators who I think are ahead of the curve compared to many of the rest of us in terms of thinking about student professional identity formation within lab and what you can specifically do to help the students think about this as their first patient, and things that actually can increase empathy and emotional development within the anatomy lab if taught in a way that's aimed at that. Versus there are also papers that talk about spending, whether it's 1 or 2 years in basic sciences actually arrests students' development of empathy and emotional. So we saw both sides of that. And again, I see this as an opportunity for us as educators to think about what impact do we want to have.
Right. I think that's an important question. Very important question. Okay, next slide.
Yeah, so these are questions from Joanne.
So, thinking about the landscape of practice. So the way I thought about the landscape of practice is I thought about a landscape first as having many topologies and many sort of, different places within a landscape. And so one is just, do you think engagement, imagination, and alignment covers everything, or are there other topologies or other markers that you would encounter in the landscape of practice that might also be a way to frame these findings? And then, just thinking about your role as a basic science educator or someone who interacts with a basic science educator, do any of these particular, I think we touched on it, but any of these findings have particular resonance? And also, if you think about the developmental context of the learner, like, are these going to change, or at least in terms of importance or whatever? So anybody want to take a stab at either of those ideas?
I can try. I think
Thanks, Bob.
Rob
I
Hill
think
is one of our,
Yeah, Rob is one of our amazing anatomists who is definitely ahead of the curve. So
go ahead. I was just going to say the same thing, Joanne, so great, thank you.
thank you very much. Yeah, and just really briefly, yeah, through collaboration with people like Taranjeet, uh, I think anatomists like myself are definitely looking at the humanistic approach to anatomy, which was absolutely unheard of in the 90s. The cadaver was a specimen to study and nothing more, and now we're seeing all these opportunities of treating the donor as the first patient. Even just the abandoning the use of the word cadaver in favor of body donor is a step in that direction. So I think the framing of engagement and alignment, et cetera, for me as a basic science educator, I kind of see myself, I do think it changes, Joe, with the developmental context of the learner. I think for first years, we're kind of all about engagement. I feel like the stone cutter who's trying to get things right and make the stone the right shape. But then as we progress like into our clerkship encounters and even whatever kind of resident encounters we have, it becomes more about aligning with their goal. Because I think by that point, to continue the stone metaphor, I think by that point, these learners' ideas get more set in stone as they get more advanced. And so it's more about fitting into the identity that they're creating for themselves rather than, I guess, trying to do things a certain way, which would be the engagement with the first years. That's just my thoughts about that.
Thanks.
I'm interested that you didn't mention imagination, which is personally my favorite.
That's the black box in the middle,
Yeah.
as I'm seeing it.
I wondered if there's anybody on here from Feinstein that has any thoughts, because I made a very special effort to go out to our research faculty at Northwell in the Feinstein lab, and I didn't know if I don't know any of them. So if anybody's on from Feinstein that has any comments, please don't hesitate. You work with a lot of learners. Maybe not.
Also mentioned something. So today I teach clinical epidemiology, which is sort of like, it's not necessarily, I guess, basic science, like hard science, but today I just taught about risk. And when I taught this last year, as a hands-on activity, I had students going through actual research article, because that's the way that I feel like they should understand how to interpret the literature. But I kind of felt like it fell flat last year when I did it. So instead this year I created some like USMLE style questions. And instead of I didn't just ask them for the answer. We went through the vignettes. I said, okay, what do you think about what this means? What does that mean? And that it felt like it was a little more useful to them. So I feel like as an educator, I'm trying to align what I do, even though it doesn't necessarily fit for me as a scientist. I think learning through like a research article is better, but it didn't quite work for them. So like being flexible with aligning with what their needs are.
Yeah, I completely agree. Maybe just based on time, maybe I can go to the so what.
Go ahead.
I'm gonna pour ahead, so you may want to close your eyes. I just had the table of data in detail. Okay. So this is another one of your questions. Joanna, is it okay if I move to the next level?
Yeah, absolutely.
Go ahead.
So, this I think is sometimes the most important part of a paper. So what? What does this mean? And I wanted to share one thought about this. So in the learning in landscapes of practice, one of the recommendations as educators, we think of ourselves as guides. All right. And working with the learners. And again, this is directly from Wagner Trainer, where he talks about how if you ever lucky enough to go on a tour, like if you're on vacation, you pay for a tour and you have a really good tour guide. In one day, you can have a meaningful experience about that actually changes the way you think about or feel about a certain thing. And if you think about what happens in that tour, you're actually doing, seeing, engaging directly. Chances are they didn't say, first you need to memorize all the names of the streets in this area. You got to know all the culture. You got to know all the laws before you even get to do anything. We're going to make you do this. The tour guide provides a safe environment, where you can feel successful and comfortable, but still you actually get to do something. And to me, that analogy, that spoke to me. And so I'll tell you about a situation. We recently totally redid our curriculum. So we have a 1-year pre-clerkship curriculum now. And I was told, you get 3 hours to teach metabolism. Go, figure it out. And so having just worked on this paper, I was like, okay, maybe I need to reframe this. How do I guide students to engage, imagine, and or align with medical specialists to catalyze their learning of metabolism? Okay, so that's my reframing of this question. And this is what we ended up doing. We use a metabolic map that it was originally developed by Stanford, but the Association of Biochemistry Educators has helped update it. And so we give this to the students. This is like, you get a map. We want you to learn how to read it. And I gave them a 2-hour introduction to what is metabolism, what are the clinical lab tests that are used to try to diagnose when there's a problem with metabolism. What does it mean if a patient has elevated lactate or elevated ketones or elevated whatever? So they had a basic framework. And then we had the map, and we gave them 6 actually really challenging patient cases. We used to use these with second-year students. These are now first-year students. And we gave them 1 hour to diagnose their patients. And the students talked about it like being a treasure hunt. And what was, really ingratiating is great to see is pretty much all the students in 1 hour could diagnose all 6 patients based on lab finding abnormalities. Okay, so thinking the way like somebody who actually is trying to diagnose these patients would do. So that's my example of how I reframed my goals based on this landscapes of practice, or our findings of the paper. All right. And then just to summarize, that basic science education can and should catalyze the professional identity development of our medical learners. And, maybe it's our job to guide students through the interfaces between science and medicine, engage them in thinking like scientists, help them imagine how developing skills will be useful as doctors, and demonstrate alignment with medical specialties. And on the other side, just delivering a mandatory curriculum does not equal a positive impact on the professional identity of future physicians.
Thank you.
And so that's my summary. I can go, Joanne, do you want me to go back to the earlier set of questions?
No, that's okay. We have a limited time, and just go forward because we added a slide.
Okay, so, all right. So yes. So
this is our librarian who usually does the bibliometrics on articles, which is usually interesting. So Leanne, do you want to go?
Sure. Hi, I'm Deanna Sager. I'm the scholarly publications librarian for both the School of Medicine and Northwell. And like Alice said, I'm going to talk about the bibliometrics about this article. So it was published only in November and has already been cited 3 times, which is great. And also has 16 captures on Mendeley, which is a citation manager. And that implies usually that people are going to go back and read it or read it again and potentially use it in their own research. And also, as you can see, there was one news mention for this article, and it was featured in the December 4th edition of Education Daily Report, which is a weekly newsletter that delivers the latest peer-reviewed education research and industry news affecting educational programs.
Thank you. That was far more positive. My interpretation is nobody cares, but I prefer your interpretation of these data. And I just want to say thank you very much. And I've had these great collaborators from all over the place that really made this project possible. It was a lot of work and a lot of fun. working with these
Yeah,
folks.
what a great group you had here.
Yeah.
Great group.
So let me stop.
So why don't you stop sharing for a minute?
Yes. May
And then
remember how
we
to
do
stop
have to
sharing.
put the last slide up before we close out, but any comments on this? Any thoughts? I just thought it was so interesting we talk about professional identity so much, and we think about it as the clinical role models and the clinicians and the clinical commitment, the clinical curriculum we develop, but thinking about what is happening in our more basic science curriculum, even though we're an integrated curriculum, I thought that's why I brought Janet here. What can I say? Yeah. Any comments? Marie, I wonder what you're thinking as our Marie is our oversight of our first, what we call 100 weeks, which includes the basic science curriculum for sure. And then, thinking to bring basic science into the fourth year.
Yeah, exactly. My brain is sort of thinking. I mean, I think we do such a great job in the first 100 weeks of integrating. It's a matter of integrating it in the clerkship spaces and in the AI spaces, and sort of like bringing it all back together. And I think especially even now as we're thinking about step one, unfortunately, we're thinking about step one and maybe changing the timing of that, the importance of having some reflection back to the basic science in the later years. So I think that's where we're going, actually. And so it was, my brain is like spinning with thoughts.
Like if we just think about Galen, I don't know who's on from Galen. I guess Rob, are you still here with us?
Yeah.
Yeah, so, do you think that they sort of have forgotten about basic science, and then you bring Galen in fourth year and that's a bring back of basic science, Janet, in fourth year. And
Yeah.
do you think that like reminds them that basic scientists are key to the understanding of clinical medicine?
That's tough. The Galen sessions are actually in the third year. So
Oh,
at the
third year, I'm sorry.
beginning of each of the core clerkships, we have kind of an anatomy boot camp, a return to the lab, and a refresher. That's the simplest way I can explain it. And I usually start off my sessions there by asking, how comfortable are you with neuroanatomy, to pick up on the neurophobia that you mentioned. If they're embarking on the neurology clerkship, how comfortable are you with that? And nobody's very comfortable with it if it's been a while since they've last thought about this content. So I think it's useful for them to revisit it. It's a kind of another step on the spiral curriculum, so to say. But I don't know if I can comment on whether that's helping, mold them into scientists or affect their professional identity in any way. I don't know if I can say that.
We'd like to give Cliff a chance to ask his question, make his comment.
I didn't see that. Thank you, Joanne. Cliff?
It's so you asked for Feinstein people to chime in, so here I am.
Thank you. Thank you.
But context is that I wanted to listen to this because frankly, I find the entire question astonishing. Before I came here, I've always done bench research, but I'm an ICU physician and an anesthesiologist. I can't imagine how I could possibly teach critical care medicine without teaching basic science. I don't know how you'd explain to somebody what's going on with a critically ill patient without explaining metabolism. And I've got to believe, with the possible exception of primary care, that that's true of virtually every field in clinical medicine. There's some basic science correlate, and bringing it in really isn't that difficult if you stop and think about the context and what you're trying to explain about what's going on with your patients. Maybe, what we should do is require everybody to spend a month in the ICU, and then they wouldn't ask the question anymore.
Well, it's interesting because, I think even primary care, basic science is important because think about the primary care diseases people are seeing. You can't get away from primary care, and asthma is very big. So that's a lot of physiology. And
sure, you're absolutely right. I didn't even think of that way.
So I think I wouldn't exclude primary care. I would include it. I think you're an interesting person because you are ICU doctor and a basic science researcher. So that's, I think that gives you a different perspective than other people who don't do clinical medicine.
Yeah. No, I do. I really appreciate that comment, Cliff. I will say, as we were embarked on this, we had all kinds of comments, everything from, well, what do you mean basic science? And people would say it is not involved in professional identity formation, who would come out and specifically say you're going to find nothing because it is not involved, quite directly, or just were astonished for the opposite reason for why we were asking the question. So I guess different people have different ideas about this topic in general.
Right. Well, I brought you here to, because I think it is an important question. So I really want to thank Janet. We're at time. I think we have to think, all of us are very focused on students and learners in the basic science area at Feinstein, but developing a professional identity. And I think we need to think how that's happening. I think anatomy is a little bit ahead of the curve, for sure. So I thank our anatomists that are on here today, for sure. I see Rob, but maybe others. And I think he's definitely ahead of the curve. So I thank him.
Thank you all so much for your interest. This is really fun.
Okay, well, it was fun for us too, and congratulations on getting into the rhyme issue of academic medicine, and forget about medical teacher that they rejected you, okay? Okay, thank you, everyone. Have a great afternoon.